Good evening, one and all. We welcome to International Webinar Series on Holistic Health, Well-being and Sustainable Development, commemorating Azadi Ka Amrit Mahotsav, nation celebrating 75 years of Indian independence, and also on occasion of World Social Work Month and also World Health Month 2022. International Conference on Social Work and Sciences towards One Health and Sustainable Development 2022 in collaboration with Sri Holistic Health Foundation India and Sri Research Institute and Center for Arts, Sciences and Wellbeing. We welcome you all once again to this wonderful webinar series. So before starting our sessions, let's take the blessings of Almighty.
कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः
With the blessings of Almighty, we shall continue for today's session. So today we have with us Mrs. Swaneshri, Assistant Professor, Department of Social Work, Dr. B.R. Ambedkar Satellite PG Center, University of Mysore, Karnataka. We welcome you, ma'am, once again for this international webinar series. Over to you on session Psychophysiological Disorders.
Thank you, sir. Good evening, everyone. I am Vanishri V, faculty in the Department of Social Work, Dr. B.R. Ambedkar PG Center, Chamradnagar, University of Mysore. Today, I am going to present a paper on psychophysiological disorders. Before that, I would like to thank the organizers who gave me this opportunity to present a paper on your behalf. Let's go to the topic, psychophysiological disorders. Psychophysiological disorders is also popularly known as psychosomatic disorder. The term psychosomatic was coined by Hein Roth in the year of 1818. It was introduced with the study of the effect of emotion on the various body organs. Psychophysiological disorders are physical diseases that are either brought about or worsened by stress and other emotional factors. One of the mechanisms through which stress and emotional factors can influence the development of these diseases is by adversely affecting the body's immune system. Some physical or medical problems can be strongly influenced by psychological factors such as stress, emotion, or personality. These medical problems are generally called psychosomatic or psychophysiological disorders. It is important to recognize that there is a physiological basis to these disorders, and therefore problems such as headache or ulcer are not just all in a patient's head. Headache and ulcers really do hurt. The term psychophysiological means interaction of psychological and physiological variables. Consequently, a psychophysiological disorder occurs when psychological and physiological variables interact to produce a pathological state. Common types of psychophysiological disorders are migraine, headache, tension headache, peptic ulcer, irritable bowel syndrome, insomnia, and essential hypertension. These problems share a common etiological theory, which is often called the diathesis stress model. The term diathesis refers to a constitutional vulnerability towards overactivity in a particular biological system, example, cardiovascular or gastrointestinal system. So today I am concentrating on three major psychophysiological disorder, that is eating disorder, sleep disorder, sexual disorder, or dysfunctions. The first one is eating disorder. Eating disorders are conditions defined by abnormal eating habits that may involve either insufficient or excessive food intake to the detriment of an individual's physical and mental health. Eating disorders are behavioral conditions characterized by severe and persistent disturbance in eating behaviors and associated distressing thoughts and emotions. They can be very serious conditions affecting physical, psychological, and social function. Eating disorders affect several million people at any given time. Most often, women between the ages of 12 to 35 years. There are three main types of eating disorders. The first one is anorexia nervosa, second one is bulimia nervosa, binge eating disorders, and pica. The first one is anorexia nervosa. Anorexia nervosa is characterized by self starvation and weight loss resulting in a low weight for height and age. Anorexia has the highest mortality of any psychiatric diagnosis other than use of disorders and can be a very serious condition. Body mass index or BMI, a measure of weight for height, is typically under 18.5 in an adult individual with anorexia nervosa. Dieting behavior in anorexia nervosa is driven by an intense fear of gaining weight or becoming the fat. Although some individuals with anorexia will say they want and are trying to gain weight, their behavior is not consistent with this intent. For example, they may only eat small amount of low calorie foods and exercise excessively. Some persons with anorexia nervosa also intermittently binge eat and are purged to vomiting or laxative misuse. Over a time, some of the following symptoms may develop related to starvation or purging behavior. For example, menstrual period sees dizziness or fainting from the dehydration, and brittle hair and nails, cold intolerance, muscle weakness and wasting, heartburn, severe constipation, bloating, and fullness after meals, depression, irritability, anxiety, poor concentration, and fatigue. The treatment for the anorexia nervosa involves helping those affected normalize their eating and weight control behaviors and restore their weight. The medical evaluation and treatment of any co occurring psychiatric or medical conditions is an important component of the treatment plan. The second one is bulimia nervosa. Bulimia nervosa means the individuals with bulimia nervosa typically alternative dieting or eating only low calories food, that is safe food, with binge eating or forbidden high calorie food. Binge eating is defined as eating a large amount of food in a short period of time, associated with a sense of loss of control over what or how much one is eating. The possible signs that someone may have bulimia nervosa include frequent trips to the bathroom right after meals, chronic sore throat, or swelling of the salivary gland in the cheeks, heartburn, and gastrotypal reflux, laxative or diet pill misuse, recurrent unexplained diarrhea, feeling dizzy or fainting from the excessive purging behavior resulting in dehydration. The medical monitoring for in these cases of severe bulimia nervosa is important to identify and treat any possible complications. The third major important eating disorder is pica. Pica is an eating disorder in which a person repeatedly eats things that are not food with no nutritional value. The behavior persists over for at least 1 month and is severe enough to warrant clinical attention. Typical substances ingested vary with the age and availability and might include the pica include is paper, paint chips, soap, cloth, hair, baking soda, chalk, metal, charcoal, or clay. Individuals with pica do not typically have an aversion to food in general. A person diagnosed with pica is at risk for potential intestinal blockages or toxic effects of substances consumed, for example, lead in a paint chips, etc. etc. The treatment for the pica involves testing for nutritional deficiencies and addressing them if needed. Behavior interventions used to treat pica may include redirecting the individuals from the non food items and rewarding them for the setting aside or avoiding non food items. These are the treatment for pica. And the second major classification of psychophysiological disorder is sleep disorders. The sleep disorders are uh, a group of conditions that affect the ability to sleep well on a regular basis, whether they are caused by a health problem or by a too much stress. Sleep disorders are becoming increasingly common in the modern world. In fact, more than one third of the adults in the world suffering from sleep disorders. Most people occasionally experience sleeping problems due to stress, hectic schedules, and other outside influences. However, when these issues begin to occur on a regular basis and interfere with daily life, they may indicate a sleeping disorder. In some cases, sleep disorders can be symptom of another medical or mental health conditions. These sleeping problems may eventually go away once treatment is obtained for the underlying causes. It is important to receive a diagnosis and treatment right away if you suspect you might have a sleep disorder. When left untreated, the negative effects of sleep disorders can lead to further health consequences. The types of sleep disorders. There are many types of sleep disorders. Some may be caused by other underlying health conditions. The first and foremost type is insomnia. Insomnia refers to the inability to fall asleep or to remain asleep. It can be caused by jet lag, that is, natural clock, stress, and anxiety, hormones, or digestive problems. It may also be a symptom of another conditions. Insomnia can be problematic for your overall health and quality of life, potentially causing due to the depression, difficulty in the concentrating, irritability, and due to the cause of weight gain or impaired work or school performance. Unfortunately, insomnia is extremely common. Up to 50% of adults experience it at some point in their lives. The disorder is most prevalent among older adults and women. Insomnia is usually classified as a three main types, that is chronic, intermittent, transient. Chronic means when insomnia happens on a regular basis for at least 1 month. Intermittent is when the insomnia occurs periodically. Last one is transient, which when the insomnia lasts for just a few nights at a time. The second major classification in sleeping disorder is hypersomnia. So, hypersomnia is include excessive daytime sleepiness, sleep attacks during daytime, sleep drunkenness. The third is disorder of sleep-wake schedule. That means the people who is not able to sleep when he wishes to, although at other time he or she is able to sleep adequately. That is like work shifts, unusual sleep phases. The fourth major category is sleep apnea. Sleep apnea is characterized by pauses in breathing during the sleep. This is a serious medical condition that causes the body to take in less oxygen. It can also cause you to wake up during the night. There are two types of sleep apnea. One is obstructive sleep apnea. Second one is central sleep apnea. Obstructive sleep apnea means where the flow of air stops because airway space is obstructed or too narrow. Central sleep apnea, where there is a problem in a connection between the brain and the muscles that control your breath. The next sleep disorder is parasomnia. Parasomnias are the class of sleep disorder that cause abnormal movement and behavior during the sleep. They are sleep waking, that is somnambulism, sleepwalking, that is sleep talking, somnolently, then night terrors, groaning, nightmares, bedwetting, teeth grinding, or jaw clenching, bruxism. So the next sleep disorder is restless leg syndrome. Restless leg syndrome is an overwhelming needed to move the legs. This urge is sometimes accompanied by the tingling sensation in the legs, and while these symptoms can occur during the day, they are most prevalent at night. This is often associated with the certain health conditions, including attention deficit hyperactivity disorder and Parkinson diseases, but the exact cause is not always known. The next type of sleeping disorder is narcolepsy. Narcolepsy is characterized by sleep attacks that occurs while awake. This means that you will suddenly feel extremely tired and fall asleep without warning. The disorders can also cause sleep paralysis, which may make you physically unable to move right after waking up. Although narcolepsy may occur on its own, it is also associated with certain neurological, such as multiple seizures. The symptoms of sleep disorders. What are the symptoms of sleep disorder? Symptoms differ depending on the severity and type of sleeping disorder. They may also vary when sleep disorders as a result of another condition. However, general symptoms of sleep disorder includes difficulty in falling or staying asleep, daytime fatigue, strong urge to take naps during the day, unusual breathing patterns, unusual or unpleasant urges to move while falling asleep, as usual movement or other experiences while sleeping, anxiety, impaired performances at work or school, lack of concentration, depression, weight gain. What are the causes for sleep disorders? There are many conditions, diseases, or disorders that can cause the sleep disturbances. In many cases, sleep disorders develop as a result of an underlying health conditions. The first one, the first and foremost causes of sleep disorder is allergies and respiratory problems. Allergies, colds, and upper respiratory infections can make it challenging to breathe at night. The inability to breathe through your nose can also cause sleeping difficulties. The second one is frequent urination. Frequent urination or nocturia may disrupt your sleep by causing you to wake up during the night. Hormonal imbalances and diseases of urinary tract may contribute to the development of this condition. Be sure to call your doctor right away if frequent urination is accompanied by bleeding or pain. The third major cause for the sleeping disorder is chronic pain. Constant pain can make it difficult to fall asleep. It might even wake you up after you fall asleep. Some of the most common causes of chronic pain includes arthritis, persistent headache, continuous lower back pain, and so on. The fourth causes for the sleeping disorder is stress and anxiety. Stress and anxiety often have a negative impact on sleep quality. It can be difficult for you to fall asleep or to stay asleep. Nightmares, sleep talking, or sleepwalking may also disturb your sleep. Next, how are sleep disorders diagnosed? The doctor will first perform a physical exam and gather information about symptoms and medical history. They may also order various tests like polysomnography, like electroencephalogram, multiple sleep latency test. The first one is polysomnography. This is a lab sleep study that evaluates oxygen levels, body movements, and brain waves to determine how they disturb sleep versus home sleep study that is performed in your own and is used to diagnose sleep apnea. The second test is electroencephalogram. This is test that assess electrical activity in the brain and detects any potential problem associated with this activity as a part of polysomnography. The third test is multiple sleep latency test. This daytime napping study is used in conjunction with the polysomnography at night to help diagnose narcolepsy. Then, how are sleep disorder treated? Like treatment for the sleep disorders. Treatment for the sleep disorder can vary depending on the type and underlying cause. However, it generally includes a combination of medical treatments and lifestyle changes. The medical treatment includes sleeping pills, melatonin supplements, allergy or cold medication, medications for any underlying health issues, breathing device or surgery, usually for sleep apnea, and a dental guard, usually for the teeth grinding. The second treatment for the sleep disorder is lifestyle changes. Lifestyle adjustment can greatly improve your quality of sleep, especially when they are done along with the medical treatment, like incorporating more vegetables and fish into your diet and reducing sugar intake, reducing stress and anxiety by exercising and stretching, creating and sticking to a regular sleeping schedule, drinking less water before bedtime, limiting your caffeine intake, especially in the late afternoon or evening, decreasing tobacco and alcohol use, and maintaining a healthy weight based on your doctor's recommendations. These are all the treatments for sleeping disorders. The last and the third classification of the psychophysiological disorder is sexual disorder or sexual dysfunction. Sexual disorders refers to a variety of problems revolving around performing or enjoying the sex. These include disorders related to sexual function. The term sexual disorder may not only refers to physical sexual dysfunction, but to paraphilias as well, as this is sometimes termed disorder of the sexual preferences. Sexual disorder affect up to 43% of women and 31% of men. Sexual disorder are often difficult to diagnose because in many cases the dysfunction occur at the partner level rather than at the individual level. The sexual disorders can be classified into four. They are gender identity disorder, psychological and behavioral disorder associated with sexual development and maturation. Third one is disorder of sexual preferences, that is paraphilias. And last one is sexual dysfunctions. The first one is gender identity disorders. The gender identity disorder are defined as disorders in which an individual exhibits marked and persistent identification with the opposite sex and persistent discomfort, that is dysphoria, with his or her own sex or sense of inappropriateness in the gender role of the sex. One's masculinity or femininity is disturbed. They include transsexualism, gender identity disorder in the childhood, dual role transvestism, and intersexuality. What do you mean by transsexualism? That is opposite to physical sex organs. It is a condition in which a person with apparently normal somatic sexual differentiation. Gender identity disorder of childhood, it is a disorder usually first manifests during early childhood, characterized by a persistence and intense distress about assigned sex together with a desire to be of an other sex. The dual roles transvestism, it is a formal diagnosis used by a psychologist and physicians to describe people who wear the clothes of the opposite sex to experience being the opposite sex temporarily but don't have the sexual motive or want gender reassignment surgery. The fourth one is intersexuality. Intersexuality is a general term used for a variety of conditions in which a person is born with a reproductive or sexual anatomy that does not seem to fit the typical definitions of a female or male. For example, a person might be born appearing to be a female on the outside, but having mostly male typical anatomy on the inside. The second sexual disorder is psychological and behavioral disorders associated with sexual development and maturation. The homosexuality. Homosexuality is a sexual interest in and attraction to members of one's own sex. The term gay is frequently used as a synonym for a homosexual. Female homosexuality is often referred to as a lesbianism. The third one is disorder of sexual preferences or paraphilias. Paraphilias are persistent and recurrent sexual interest, urges, fantasies, or behaviors of marked intensity involving objects, activities, or even situations that are typical in a nature. The paraphilias are classified into many types. The first one is transvestism. Transvestism, we already know that it is commonly termed as a cross dressing, means to dress in a cloth of a opposite sex. The second one is pedophilia. Pedophilia means having a interest with a children by adult, usually under 13 years old. The third one is exhibitionism. Exhibitionism, it is derivation of a sexual gratification through compulsive display of one's genital to the others. Fourth one is voyeurism. Voyeurism is a practice of gaining sexual pleasure from watching others when they are naked are engaged in a sexual activity. The fifth one is frantorianism. It is the act of touching or rubbing one's genitals up against a non consenting person in a sexual manner. The next one is zoophilia. Zoophilia means sexual attraction of a human towards a non human animal, which may involve the experience of sexual fantasies about the animal or the pursuit of a real sexual contact with it. The last method in the paraphilia is sexual masochism. It is intentional participation in an activity that involves being humiliated, beaten, bound, or otherwise abused to experience sexual excitement. The last and fourth disorders in sexual dysfunction is this sexual dysfunction. These are frigidity, impotence, premature ejaculation. Frigidity means it is the inability of a woman to attain orgasm during the sexual intercourse. Impotence. Impotence occurs when a man unable to achieve an erection, maintain an erection, or ejaculate of a consistent basis. Premature ejaculation. Premature ejaculation is the organism or emission of a semen occurring just before or shortly after beginning sexual intercourse. The next topic is what are the symptoms of sexual disorders? There are many symptoms and which is differ from men and women and both common among men and women. The symptoms of sexual disorder in men are inability to achieve or maintain an erection suitable for intercourse, absent or delayed ejaculation despite enough sexual stimulation, inability to control the timing of ejaculation, that is, early or premature ejaculation. In women, the signs and symptoms are inability to achieve orgasm, inadequate vaginal lubrication before and during the intercourse, inability to relax the vaginal muscles enough to allow the intercourse. These are all the symptoms of sexual disorder or sexual dysfunction. Then, what are the causes of sexual disorders? There are two types of sexual disorders. One is physical disorders causes, or second one is psychological causes. Physical causes. Many physical and medical conditions can cause problems with sexual function. These conditions include diabetes, heart related problems, and vascular related diseases, neurological disorders, hormonal imbalance, chronic diseases such as kidney or liver failure, and alcoholism and drug abuse. In addition, the side effects of some medications, including some antidepressant drugs, can affect sexual function. The second causes for the psychological causes is these include work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, concerns about body image, and the effects of a past sexual trauma. How the sexual disorders diagnosed? The diagnosis for sexual disorders are typically lab testing plays a very limited role in the diagnosis of a sexual dysfunction. An evaluation of the attitudes about sex as well as other possible contributing factors like fear, anxiety, or past sexual trauma, abuse, relationship concerns, medications, alcohol, or drug abuse, etc., helps a clinician understand the underlying cause of a problem and recommend the right treatment. Then, the next step is how to be treated. Most types of sexual dysfunction can be addressed by treating the underlying physical or psychological problems. Other treatment strategies include medication, psychoanalysis, hypnosis, group psychotherapy, behavior therapy. Medication, when medication is the cause of the dysfunction, a change in the medication may help. Men and women with hormone deficiency may benefit from the hormone shots, pills, or creams. Mechanical aids. Aids such as devices and penile implants may help men with the erectile dysfunction. The next one is sex therapy, that is behavior therapy. Sex therapists can people experiencing sexual problems that can't be addressed by their primary clinician. Therapists are often good marital counselors as well as. The next behavioral treatment is involves various techniques, including insights into harmful behaviors in the relationship or techniques. Next one is psychotherapy. Therapy with a trained counselor can help you address sexual trauma from the past, feelings of anxiety, fear, guilt, and poor body image. Last method to treatment is education and communication. Education about sex and sexual behavior and responses may help you overcome anxieties about the sexual function. Finally, concluding that psychophysiological disorders is concerned with the understanding the interrelation between the mind and body and behavior. This group of disorders is characterized by physical symptoms that are caused by emotional factors. The individual may not be consciously aware of his emotional state if there is an additional psychiatric disorder. It should be diagnosed separately whether or not it is presumed to contribute to the physical disorders. Thank you.
Thank you, ma'am, for the insightful presentation.
Thank you, sir.
Physiological disorders, very well presented.
Thank you, sir.
Yeah, participants, if you have any queries, you can use chat box or you can raise your hand so that we can unmute. Okay, if there are no queries, then okay, let me ask one query.
Okay, sir.
Ma'am, when we are talking about these sensitive issues, like especially it's not really sensitive, but the stigma attached to approaching certain aspects of health, like sexual or reproductive health. It is not
Okay.
often openly talked or they do not actively approach. So what do you suggest? Because that is also very important for
Okay, sir. But actually, according to my perspective, is we should provide a sexual education after high school level because it is important. Is that in these days we are what we call we are having the problems of sexual disorders because of anxiety, stress, so many things. And many number of people, they don't have what we call that is just to talk about the sexual problems, because they feel like that it is something very bad. Okay, that's why from the high school level to college level, we should provide sexual education, and what are the consequences and what are the problems we should provide from that age too. And we should taught them as an education, not like it is a negative thoughts. This is my suggestion, sir.
Yes, ma'am. That is there. Actually, it was part of curriculum also, but often somewhere it is not given that importance or just taught as for the sake of teaching and just for few minutes
Yes,
or
sir.
something like that.
It's
So
right.
it should not be as a ritual which is being done for the sake of ritual, but it should have the commitment because that is very important. Nowadays, we see a lot of these issues from
Yes, sir.
school days itself. A lot of abuse is
Yes, sir.
happening, and so these things are happening. So it is very much important to for the students or school or college going students. So what is right, what is not right?
Yes, sir.
They should also understand the consequences of involving in such acts and in all terms, not only just physical, social, economical, emotional. All these aspects has to be taken up so that they will understand. I mean, what is the right time to do something, what is not the right time to do something. All these aspects has to be properly dealt with. This lot of media, especially the media is in one way promoting good practices, but most of the time what we see because they are into business, so they want to do only which can sell for them, which can generate income for them. In that cases, what is happening, we see a lot of issues that are, I mean, negatively portrayed or the negative aspects are hyped and those are widely promoted. Like we are seeing this lot of premarital or extramarital affairs, or
Mm.
even this children also using certain vulgar language or double meaning words, or they are also portrayed as what we can as a messengers, and they are being misused. So these all are aspects are nowadays few movies also, recent movies also, where children are portrayed something in a different way, which is I mean not to be taken in a very positive way. So all these things are also influencing them. So in spite of all these factors, if we are not able to provide them proper guidance at the school or college level itself, then people nowadays we see a lot of cases that are coming from school and college children. They want to experiment first things. So because it was in the media and everywhere, it is portrayed in such a way that they want to experiment and see. But even for that, this is lack of awareness. There is a time also, even if you want to experiment and experience also, there is a time, there is a place, there is a situation. And so these issues are to be properly addressed. Otherwise, these cases continue to remain growing only day by day. We don't see any decline of cases, though they reported, unreported. what we can see, a lot of cases are happening even at school level. So that too, we are recently seeing few cases in primary level also. So these are a greater concern. I mean, should be taught as a subject, as an academic. There is nothing taboo or stigma, but it should be presented in such a way that students at that age level can understand. Maybe it may not be the same as we provide for adults, but maybe in another way, maybe as a story, or maybe as a cartoon or something like that, or maybe as a fictional characters, or in a way the presentation should be different so that they can be understood by the children, taken in a very good sense, in a positive, constructive, productive manner. So these materials also needs to be, teaching learning materials also has to be designed in a such a way that the outcome has to be in an appropriate way through which this subject can be taught. And even culture also has greater influence on these aspects, because nowadays the kind of the promotion that is going on towards different cultures, especially with media or even in the society, they also have significant impact on children, students. Not only with the children, we see a lot of similar issues with adults as well. Maybe the value education, values which are maybe lacking or which are being ignored, maybe more of value education will help in reducing such things and then promoting positive health. So these measures also required at a society level, at a community level. More awareness is required that can be taken up. So what do you say, and what's your observation? Maybe it's personal or maybe professional observation. How do you deal with such cases, if any, if you have you ever come across? What?
Hello,
Yeah,
sir. Is it question for me?
yeah.
Okay. My observation. Actually, I am doing the teaching in the in the level of master degree classes. Still, our students are hesitate to talk about this topic in the classrooms. They actually, we have the paper of human growth and development. So while we teaching about reproductive organs, they feel like shy, actually, because they are came from the background of rural, or they bought up like a what we call, this is bad thing, we should not talk about, and children do not talk this type of topics in front of elder adults. So they bought like that. While teaching in this level, it is a little bit difficult for us. They know about these all things in different manner, like in movies, in videos, like in other manner, they know that, but they do not have what we call they do not have basic knowledge what is education about sex. They think that the word sex itself is a bad. So we should teach them about what is sex education, what is good, what is bad. And for example, in the primary level, we should teach our children in home itself, which is good touch, which is bad touch, and how to deal with others, and self, what we call self protection from the others. Like we study about other topics like overism, exhibitionism, all topics we know that. So we should teach the people, children, or we should tell them what is good, what is bad, and how to deal with the others. So these are all the what we call my suggestions to this topic, sir.
Yes, ma'am. As you said, we have to take up from the school level itself in a different format as per the age group and as per the target population. These entire teaching learning materials have to be redesigned if required, and may be presented in such a way that it may not look any topic that might be portrayed as a prohibited or something that cannot be discussed. So hope we will have similar materials developed, and especially when we are in social work, because social workers are going to be first responders, and they are going to different NGOs and corporates or CSR departments in various organizations. They are working on various issues. So this is also a very good opportunity, very good avenue where they can get their employment, and also they can work on various projects. So it is very necessary, uh, very much required for social workers to be equipped with this kind of knowledge so that they can be trained, and they can train others when they go to the community. Maybe even at that level also, when there is the stigma or taboo attached to such issues, then we need to desensitize them or sensitize to such any topics. If they are very sensitive, then desensitization is required to openly talk about such issues that will help in the long way to address these issues. We will all continue to provide our valuable inputs. Thank you once again
Thank you, sir.
for your wonderful presentation.
Thank you so much, sir.
We are sharing feedback link in the chat box. You can fill it up. Is there anything, ma'am, you would like to share before concluding?
No, sir. No, sir.
Okay. Then we thank you once again on behalf of Sri Holistic Health Foundation and Sri Research Institute and Center for Art, Sciences and Wellbeing, and also on behalf of all the participants for joining this wonderful platform, and look forward for your presentations in future as well.
Thank you so
Wish
much,
all
sir.
the success.
Thank you.
The feedback link has been shared in chat box. Kindly fill up the feedback form, and also join Telegram channel and also Facebook channel, where you can get the download links for e-certificate. Generally, e-certificates are issued within 15 working days. So this month, entire month, last month, we have continuous programs. There is little bit delay due to various reasons. Maybe that may continue for another 1 week, but after that, you will regularly receive on time. We have been issuing on time only this month due to lots of programs happening. So there was a delay. So you can fill up the form, and by the end of the month, you will be receiving certificates. Maybe another 1 week, we have pending works, we will finish it. And you can receive all the certificates on time. So thank you everyone. Before leaving the webinar platform, kindly fill up the feedback form. So we will keep the meeting on for another 5 minutes so that you can fill up the feedback form. Thank you everyone for joining us. So tomorrow there is an important announcement. Tomorrow we are having international workshop come webinar on a very important topic, that is life support systems. This is very important for everyone. Uh, Basically, this kind of training is arranged for doctors and nurses, but we thought we can empower our social workers, psychologists, counselors, even our doctors and nurses with the awareness of first aid program and also life supporting information where we can use strategies. So if we know, we can save lives. That is very important topic. We have already shared the registration link. So as usual, you all know, every Sunday also we have a program that starts from 10:50, that is 11. So till 4 p.m. tomorrow, we are having these sessions on life support systems in the morning sessions, and in the afternoon sessions we are having last week also we conducted this workshop on CV resume preparation. So many have requested that they could not attend. So we have all scheduled these sessions tomorrow also. The speakers will be joining and you can prepare your resume. This is very important, where resume can fetch you jobs. I mean, that is the first step to start on careers. So share the links with everyone, registration link, and we have shared the same links in Facebook group and Telegram channel. You can register and join tomorrow. This will be very useful, even though specially designed for students, but freshers and mid-career professionals or aspirants, but even professors and other professionals can also join. It will help them to know about these aspects, and you can in turn teach the students or your research scholars or students and other even in community also it can help us. So do join tomorrow at 11 a.m. and the link will be same. The joining link will be same for all the events conducted by the organizers. Just see the timings daily. We have been organizing these sessions from 5:30. So till now, but from next week we are changing the timings because most of us are working. So we have colleges till 4:35, and we have to travel back. So there are students also who want to join. So considering all these requests, so we are shifting half an hour ahead, and we'll be starting at 6 o'clock. So whoever would like to present or whoever would like to participate, you can join at 6 o'clock. So we'll be having sessions. The maximum time allotted for speakers is 2 hours. They can take it depending on the topic or depending on the time required. They can take maximum of 2 hours, but if they want to end early also, it's fine. And as per the requirements, they can conclude in 30 minutes, 1 hour, 1.5 hours, or maximum 2 hours as per that. So thank you one and all. Registration form for tomorrow's international workshop has been shared in chat box, and also feedback form also has been shared in chat box. Kindly fill up the feedback form and also use the registration form to register. There are no individual emails sent unless and there is specific thing. So kindly bookmark or add to your calendar these links. You can daily add as a recurring event in your calendars. so that you can be reminded of the events. Daily you can mark it as 6 to 8 p.m. daily, and on Sundays you can mark it as every Sunday or weekly, and you can just save the link, joining link there, so that you can join. Sunday it is generally from 11 to 3 or 4 as per the sessions. Thank you everyone once again for joining.